Good morning, everybody. Thanks so much for joining me here on Wave Now. We are going to an update from Louisville Metro Department of Public Health. They're providing us an update on the harm reduction efforts at the Louisville Metro Department of Corrections, LMDC. And he knows that the jail, that they're reversing overdoses and saving lives, as well as showcasing a new vending machine at the jail that is supplying free Narcan. Let's listen in.
To providing training to residents on the proper use of Narcan. Within days, there was an overdose in one of the housing units, and an individual in custody was able to quickly access the Narcan and prevent a death. Since then, LMDC has had 24 overdose reversals by residents using the Narcan in the housing units. I want us to stop and think about this number for just a moment. 24 lives have been saved by residents alone. We have instilled trust and resources, and guess what? It has been shown to work and work effectively. These 24 saved lives alone do not include the number of lives that have been saved by correctional and medical employees who now also carry Narcan, receive training, and have access to Narcan at all workstations. Most recently, LMDC and the Public Health Department's MORE program have also started a modified therapeutic community treatment program inside of the jail, where residents follow a regimented recovery program that is founded on the principle of recovery capital. Put simply, recovery capital is the total resources that a person has available to find and maintain their recovery. There are different types of recovery that we all have, whether that be personal, family, social, community, or cultural capital. This framework allows individuals to sustain recovery and to reduce the risks of using by providing the resources and social support that is necessary for long-term recovery, and it also takes into account the different needs of our marginalized communities. To highlight LMDC's value and emphasis on treatment and recovery, an entirely new team has been integrated into the traditional correctional organizational structure. For the medication treatment program alone, we have 3 counselors, 2 peer support specialists, 3 nurses, 1 reentry specialist, a medical director, clinical lead, program lead, an LMDC program coordinator, a licensed psychologist, licensed social workers, clinical psychology doctoral students, and a treatment linkage coordinator. Outside of the programming and services LMDC has developed inside of the jail, we have also integrated harm reduction practices as people discharge LMDC and re-enter into the community. Through partnership with the University of Kentucky's Healing Community Study, LMDC has received both technical and financial assistance through grant funding, which has allowed us to install a harm reduction vending machine in LMDC's exit lobby. This means that any individual that is leaving the doors of LMDC now has free access to Narcan, and we are equipping people with tools that we know work. In the future, the Public Health Department will be continuing to span this harm reduction kiosk, and it's going to continue to remain free and accessible to all of our residents. The collection of harm reduction interventions, including the medication treatment, programming, counseling, reentry services, peer support, and free public access to Narcan both inside the jail and upon release are all the ways that LMDC and our community is fighting to save lives. We must recognize that substance use and mental illness are disorders that require treatment. These are no different than diabetes or hypertension. Together with our community partners, LMDC hopes to provide individuals the necessary tools that are proven to save lives and equitably assist individuals with access to recovery. Given the reality of where we are at today and a jail population that has approximately 2/3 of its population with a diagnosable substance use, mental health, or co-occurring disorder, LMDC must reimagine the role of corrections and serve as a point of intervention, a a place of rehabilitation, and a linkage point for access to long-term and sustainable recovery. I could not be prouder to serve the City of Louisville alongside my invaluable partners, colleagues, and community members. Together, our work has shown what it truly looks like to break down the walls of stigma, enter uncharted territories of using harm reduction approaches, and taking an active stance against the fight to end fatal overdoses. I want to thank everyone again and all of the amazing partnerships that LMDC has made to make this work possible. And next, I would like to introduce Dr. Oser with the UK Healing Community Study.
Thank you. My name is Carrie Oser, and I'm a professor at the University of Kentucky and a co-investigator on the Healing Community Study, which is the largest implementation science community-engaged intervention trial funded by the National Institutes of Health and also by the Substance Abuse and Mental Health Services Administration. The Healing Community Study is a randomized trial at the community level in which we're testing the effects of the communities that heal intervention in 67 highly impacted communities across 4 states. Those 4 states are Kentucky, Ohio, Massachusetts, and New York. The Communities That Heal Intervention seeks to engage and partner with opioid-focused community coalitions through a multi-phase process to promote data-driven selection of evidence-based practices that would have the most impact on those counties. The evidence-based practices are well documented and known to reduce overdose deaths. They include increasing access to overdose education and naloxone distribution. Number 2, increasing access and linkage and retention to medication treatment for opioid use disorder. And number 3, advancing prescription opioid safety. In Kentucky, the Healing Community Studies to date has worked with over 300 agencies, including LMDC, and we've been able to implement an array of evidence-based practices with support from local coalitions. This includes distributing over 86,000 units of naloxone or Narcan, as well as linking almost 1,000 people to medication treatment for opioid use disorder. We're grateful for the opportunity to partner with the Louisville Metro Department of Corrections and to provide financial support and technical support for the naloxone vending machine. The risk for overdose is elevated when people are discharged from jails. Research has found that in the first 2 weeks after being released from a correctional institution, that people were 40 times more likely to die of an overdose than that someone in the general population. 40 times is quite a lot. And the provision of overdose education and naloxone distribution to people at discharge from jail is one proven strategy for reducing overdose fatalities in this population and also in our communities. The Louisville Metro Department of Corrections' new naloxone vending machine will ensure people are educated on how to recognize the signs of an overdose event and respond appropriately. And they'll also have access to this medication at no cost as they are released from the institution. This is really a sustainable model program, and we hope that other jails across the Commonwealth will follow the lead of LMDC in implementing harm reduction programs such as overdose education and naloxone distribution, including implementing vending machines in their institutions. Thank you for your time, and I'd like to introduce Ben Goldman.
Thank you, Dr. Oser. I'm Ben Goldman, a community health administrator with Louisville Metro Department of Public Health and Wellness. So you've heard a lot about harm reduction today, and I'd like to take a moment before I begin my remarks to discuss what harm reduction is. Harm reduction acknowledges that behaviors carry risks, and some behaviors carry more risk than other behaviors, but that there are ways to reduce this risk and reduce the harm associated with those behaviors without demanding a complete cessation of that behavior. So a popular example is seatbelts, right? Like many of you, I engaged in a high-risk behavior this morning. On my way here, I drove through Louisville to arrive at LMDC. That is a behavior that leads to many countless deaths across the country and over 100 deaths in our community each year. It carries a risk, but given my options, given the choices I had available, the amount of time, the distance I had to travel, for me personally, driving here today made the most sense. But I didn't have to decide just between driving and not driving. I was able to reduce the risk inherent in this risky behavior by wearing a seatbelt, by making sure that I followed the traffic rules and regulations, by not being intoxicated, and by getting a good night's sleep before driving. Harm reduction when it comes to substance use is no different. Using substances does carry risks. Using alcohol carries risks. And there are ways that we can reduce those risks, whether that substance is legal or illegal. One of the most effective ways of reducing the risk of the worst outcome associated with substance use is overdose education and naloxone distribution. When people have access to Narcan, they're able to save the lives of the people around them. Like driving and drug use, the practice of incarcerating people also carries risks. One of the gravest of these risks is also overdose death associated with the abstinence during the period of incarceration, the decrease in tolerance associated with that abstinence, and the subsequent elevated risk 40 times higher in the first 2 weeks of being released from a carceral setting of dying by an overdose. Overdose education and naloxone distribution, as you heard, are an evidence-based practice for reducing that risk. And it is a practice that was popularized and overwhelmingly implemented by people who use drugs to save the lives of their friends and family members. And there's an important lesson in that the people who are most stigmatized, who are most marginalized, who are most criminalized, actually have many of the solutions to the problems they are facing when given the resources they need. Contrary to popular belief, there are more people inside of this facility, inside of Louisville Metro Department of Corrections, more people who are incarcerated who have saved a life than people who have taken a life or been charged with taking a life. Harm reduction means meeting people where they are, both literally and figuratively. In our society, people who use criminalized substances are, by definition, disproportionately likely to find themselves incarcerated. And this harm reduction effort occurs against a backdrop of the most contaminated, most dangerous drug supply our city has ever seen. Our residents who use drugs are finding synthetic opioids across the board in all unregulated substances, including counterfeit prescription pills that purport to be Xanax, Vicodin, or Percocet, and other prescription medications, cocaine, and methamphetamine. This means that a number of our residents and a wide variety of our populations who were not previously at risk of opioid overdose are now dying of opioid overdoses and experiencing opioid overdoses. The populations that have disproportionately been hit in the past year are our African American and Latinx residents who saw an increase in overdose fatalities in 2022, despite an overall decrease in our county's rate of overdose fatalities. Additionally, our drug supply is also now increasingly seeing xylazine, a deadly tranquilizer that increases the risk of overdose death. So harm reduction is all of our business, and harm reduction is for everybody who thinks that we've seen too many deaths in our community and would like to help reduce those deaths. Harm reduction also calls us to contextualize harm in social inequalities like racism and poverty that exacerbate drug-related harm. Our department's Center for Health Equity reminds us that people make choices based off of the choices they have available to them. When it comes to substance use, decades of stigmatization, marginalization, and criminalization have led to far too many of our residents winding up behind bars or dead from their substance use. But if the past 50 years have taught us anything, it's that we cannot arrest our way out of this crisis. And fortunately, harm reduction here offers us an alternative as well. It offers us an alternative in the 24 lives that were saved by incarcerated people the staggering 11,000 lives that have been saved by participants in our harm reduction services program since its inception, and in every resident who makes a choice to take care of their loved ones by accessing harm reduction resources. These life-saving initiatives provide resources that help our residents take care of themselves and others, which is essential to advancing public health and health equity. It is inspiring to see our federal, state, and local governments come together to support harm reduction and to loudly declare and proudly declare that nobody in Louisville deserves to die of a drug overdose or drug poisoning. I'd like to invite back up a champion of public health and harm reduction, Dr. Lederman.
Thank you, Ben. So I would like to close us out by, again, sharing how incredibly grateful I am and proud I am of the great strides that have been made here at LMDC and in our community, and take this as an opportunity as a call of action to other states and other departments. We have seen the research which has shown us the countless benefits of incorporating medication-assisted treatment and harm reduction strategies into criminal justice treatment programs. Statistically, individuals who receive Suboxone and methadone treatment prior to release are more likely to engage in treatment after their release. Individuals who begin medication treatment while incarcerated engage in post-release treatment and stay in treatment much longer. Moreover, individuals who participate in medication treatment and counseling while in custody are less likely to test positive for illicit opioids at 1 month following their release. Aside from the research, I can speak confidently on the success we have seen at LMDC. We have recognized that significant strides in this department have been made towards drug interdiction, which is stopping illicit substances from coming into the facility. However, we also recognize that this is not enough. We have implemented increased screening and detection at intake. We have increased our intel positions, developed a canine unit. We have removed all physical mail, and yet the reality is that correctional facilities remain a critical risk for illicit substances and contraband. Our goal at LMDC is to make every single effort to prevent any harmful and life-threatening substances from entering into the facility, while also acknowledging that this is a challenge that we still face. Drug interdiction alone is not enough, and as my colleagues have continued to reiterate, we must depend on evidence-based practices and have access to life-saving measures in the case of an overdose. I want to show everyone a very small box that has a huge outcome, and this is what we know can save lives. And we are excited to show you all our new vending machine that is in our exit lobby. We are also happy to provide Narcan to anybody that is interested in carrying Narcan. We encourage everybody to have a box, whether it be in your purse, your backpack, your pocket. Narcan is something simple, and we know that it's something that can save lives. So I want to take us back to our first 3 takeaways, which are harm reduction, recovery capital, and collaborative partnership. These are our pathways to saving lives. Thank you all again so much for being here today. And I want to invite Ben and Dr. Oser back up and open it up for any questions that folks may have.
Doctor, can you pronounce your name for us, please?
Yes, Dr. Lederman, Leyderman.
And your first name is pronounced?
Maria.
Maria. The free Narcan and the vending machines, and for the people leaving the jail, it's not for themselves. It's for them to use just for other people. Is that correct? Is that how that works?
Yes.
Okay.
So Narcan is used if somebody is experiencing overdose. So it's encouraged if you are using to be with somebody else, and then it would be administered to somebody that is having an overdose.
Part by ignorance here, but you can't use it on yourself, I guess is the question. Is that correct?
That's correct, but it's still the best practice to provide people who are at high risk of experiencing or witnessing an overdose, because someone who's at high risk of experiencing an overdose can in turn give that to their family member, their friend. Sorry. It is also best practice to give naloxone, to distribute it to people who are at high risk themselves of experiencing overdose, because they can in turn provide it to their loved ones, their neighbors, their family members, anybody who could reverse their overdose.
And Ben, you said that more people in jail have saved a life than have taken a life. Can you expand on that? What do you mean?
Absolutely. When we came through the dorm, doing all of the dorms, we had to train the incarcerated population on how to use the naloxone. And in every single dorm we went to, my team asked, how many of you all know how to use naloxone? And, about half or more of the people raised their hand. Then we asked, how many of you have used Narcan to reverse an overdose? And in almost every dorm, at least one person raised their hand. And looking at the statistics, there are not that many people facing murder charges or manslaughter charges in this facility. And we know every day overdoses are being reversed by people who use drugs, by their friends, by their family members, and by their neighbors.
We've covered other stories of vending machines where Narcan is emptied in a matter of days. How are we prepared for this, and what is the process to replenish the vending machine with Narcan?
So we are prepared for this. This is a targeted intervention. So the population that it's aimed at is prioritizing people who are at that elevated risk of overdose because they're leaving incarceration. So it's in the exit lobby for people who are exiting the jail, calculating the number of people who are exiting and the number of people who might take some. The UK HEAL initiative has made clear that they're able to supply us with everything we need. And already we had a soft launch of it, and I believe 67 units have already been distributed. It's still open for business, has lots of Narcan available to it.
Carrie, you said that the risk is higher of an overdose is higher for people leaving the jail. Why is that? Why was that?
Yes. Risk is higher when people are leaving correctional institutions because most people are not using opioids when they're in a correctional institution, so their tolerance is reduced. And so then if they are released and return to use at the same rate, they're at elevated risk of an overdose event.
Will the public be turned away from accessing this vending machine?
The exit lobby is closed off from public access, so it will only be available for people that are walking out of the jail into the community. And this goes back to kind of a public call to action that there should be free, accessible Narcan in the community as well. I think typically people don't want to be coming back into a jail for resources. And so we would encourage other access to Narcan that would be readily available.
And just to put in a plug here for all of the many places that you can access Narcan, our health department is committed to providing free Narcan to anybody who comes to our harm reduction sites, to our main branch at 400 East Gray Street during business hours. You can also call our office. If somebody isn't able to make it to one of those locations, they can just call our health department, and our overdose quick response team will deliver Narcan to their home, usually within about 48 hours.
How much can each person who's leaving get? Is it one box per person, or is there a limit on that?
I don't think there's a limit, right?
Because this is a research study, there are a few questions that ask about a person's demographics, not their name or any identifiable information, but they have to answer those questions in order to get the naloxone unit. It takes less than a minute. And so if they wanted to do that process twice, and they could have access to more naloxone. And I'll also say that naloxone is an over-the-counter medication now, and it will be widely available in retail pharmacies, Walmart, an array of retail vendors.
You mentioned they have to answer some questions before accessing that. So is that like on a screen pad on the vending machine, or person asks that, how do they answer those questions?
Yes, it's through the vending machine. There's a pad that they answer those questions.
And you mentioned there's a soft launch of this already. How many days, I guess, has it been vending so far? Or when was the first day of that?
Yeah, about 2.5 weeks. 3 weeks, 2.5 to 3 weeks. And 67 units have been distributed.
Then some critics of this will say that offering naloxone, Narcan, increases the likelihood that someone's going to use drugs because they know they're not going to die. They give their buddy a pack of Narcan and they start doing drugs. What's your response to that?
So fortunately, my opinion is irrelevant because we have a ton of evidence. This is something that has been studied. It's something that we've had natural experiments throughout the country of jurisdictions that have implemented Narcan and overdose education and naloxone distribution that we can compare to communities that haven't. We do not see an increase in substance use associated with Narcan distribution. What we do see is a decrease in fatal overdoses. So the numbers are really clear. This is something that reduces deaths in our community, and every person whose life is saved continues to have opportunities to access services, to find help, and to improve their life.
What happens when an incarcerated person opens up the box with Narcan in their dorm? Does it trigger a medical response? Is it wired to something? Is there, some kind of backup that?
Yes, so all the Narcan inside the housing units will trigger an alarm once it's opened. And the reason this is in place is to make sure that medical and security staff are notified. That way, after Narcan is used inside the housing unit, medical staff is able to provide additional assessment and treatment as needed.
You have that people who are incarcerated reverse 24 overdoses. What about people who are not incarcerated, just working in the jail? Do you have any numbers on that, on the number of overdoses reversed?
I do not have the exact number. However, it has been a significant amount of both officers and medical staff, but I don't have the exact number today.
How is Narcan used? How do you do it?
And you want to give us a demonstration?
Sure. It's a nasal spray, very similar to Flonase. So the great thing is every unit, even though people get trained, every unit has its instructions right on the front there. A box contains 2 doses. So essentially, if you find a person who's experiencing overdose, you want to lay them on their back. You can, if you're alone, administer a dose of Narcan. If you have someone with you, have them call 911. You take the nasal spray, you insert it into their nostril. The button is a little bit sensitive, so we actually advise people not to hold it with their thumb on the button in case they should accidentally spray it. It's 1 dose. So sticking it into their nostril until the fingers touch the nostril, and then you press the button until it clicks. That's the dose. You can perform 2 minutes of rescue breaths, and then if the person hasn't recovered, you administer the other dose.
And what does it do?
So I'm not a doctor. I would say the layperson description of what it does is it knocks the opioid off of the receptor that it's bound to, that's causing the respiratory collapse. It knocks that off and blocks that receptor so the opioids can no longer bind to it for a period of 60 to 90 minutes.
Do you know how many other counties are doing this? I know Madison County was working with the Healing Community Study on distribution of Narcan, and they have a vending machine as well in their jail.
Yes, we've tried to work with all 16 counties to be able to provide overdose education and naloxone distribution. I don't have the exact number of counties that have implemented overdose education and naloxone programs that are jail specific, but we've worked with over 300 agencies, including behavioral health, healthcare, social service, and criminal legal system agencies.
So after this, we'll be able to bring folks downstairs to the exit lobby, and you all can see the machine, interact with it, see what it's set up. And then if you all have any additional questions, feel free to reach out to us or Healing Communities or Public Health. And again, we really appreciate you all being here and taking the time today.